Good evening to all the viewers who are watching live and will be watching on a recorded version. And this is to hereby inform you that we have few notifications regarding the issues with certificates and other Spotify links and other problem related things. We will just get you with on that, and we will talk about that in the later part of the CME. So without wasting any more time, let's just start the countdown of 30 seconds.
Good evening, all the viewers across the globe. Good evening, sir.
Good evening, very good evening.
And wishes of the ongoing festive season to all our respected viewers. And being from the first, we are now on the 58th edition of Medical Education Program, organized by National Institute of Homeopathy Alumni Association. With the permission of our President, Dr. Kalyani, sir, please can we call on our inaugurated tonight?
Sure. Please call and start.
Thank you, sir. We are going to request our inaugurator tonight, uh, alum from NIH, the 27th UG of NIH, now pursuing her MD at DND, Dr. Surbhi.
একটু পরে করুন, আধ ঘন্টা পরে।
Over to Surbhi. Please unmute. Surbhi, please unmute yourself.
Hello. Good evening, everyone, and happy Lakshmi Puja to you all. A warm welcome to all the respected teachers and all the respected viewers and all the alumni. I am so grateful to welcome you all in this today's event, that is 58th online CME on behalf of NIH Alumni Association. And I am Dr. Surbhi Yaduvanshi from 27th batch NIH UG. I feel privileged to open this event and want to thank Dr. Bidyut Mukherjee sir, who gave me this opportunity. And I'm happy to announce that we have viewers over 21 countries apart from India. So total 22 countries. So without wasting much time, let me introduce you to today's moderator and speakers. The moderator for today's program will be Dr. Arijit Pal Choudhury sir, who is the alumni from first batch of MD NIH, and he is currently the reader and HOD at the Bengal Homoeopathic Medical College and Hospital in the Department of Gynae and Ops. And our eminent speakers for today's program, our first speaker is Dr. BP Srivastava sir, and he is from 12th batch NIH, Deep NIH, and he'll be speaking about what nails say about the status of health. And I'm happy that I am the direct student of sir. And second speaker is Dr. Jhanwar, and he'll be speaking about mental health and homeopathy. Thank you, everyone. Over to moderator, sir.
Good evening, everybody. Thank you, Dr. Surbhi, Yaduvanshi. Today, both the topics are very, very interesting, and I think it's very, very clinical from the point of view. And hope both the speaker will deliver it with their best efforts and with their best in stock to the homeopathic fraternity. And so I request first Dr. Professor Birendra Prasad Srivastava to present his deliberations over what nails say about the health. So, Professor, Birendra Prasad Srivastava, please present your deliberations regarding
Thank you
the
very much for inviting me as
relationship
a
between the nails
speaker.
and health.
Thank you very much for inviting me as a speaker of today's CME program organized by National Institute of Homoeopathy Alumni Association. Uh, Good evening to all my viewers and my respect and regards to uh, respected Dr. D.N. Kalyani sir, my senior Dada, and he is also very close to me since my studentship in NIH. And today's inaugurator, my beloved student, Dr. Surbhi Yaduvanshi. Today's moderator, my younger brother, Dr. Arijit Choudhury, Secretary of Alumni Association, Dr. Bidyut Mukherjee, and my beloved Dr. Orko Mukherjee, and all my viewers. So, after Navratri and Durga Puja, today is also one of the auspicious day for all of us. So, with happy Mahalakshmi Puja to all of you. And now I am going to start my today's presentation, that is what nails says about the status of health. So
Sir,
now I
please.
am sharing the screen.
Sir, it will be best if you just click on the hide button and just open the slideshow. Click on the hide button if possible. You turn off your camera, sir. Sir, you turned off your camera, sir.
Can you see? Can you see?
No, sir, you have turned off your camera, sir. A presentation was showing, sir. Let me just guide you with this again. Please upload the slides. There will be an option. Click on the present and present button, then you will see slides option and open
Yeah.
from there.
Upload.
It's best. It's now can be seen, but I cannot means this viewer cannot see you, sir. Your camera is being means closed.
Just wait.
Okay,
Now
sir.
can you see the slide?
We can see the slide, sir.
Okay. Now the only the region for camera. Okay.
Hmm. Sir, just turn on the slideshow if possible.
Okay.
Sir, there is a problem. You just there is a problem. You have to escape
Oh,
again, and you have to just go through the process right again. Sir, let me just guide you with this. with this. You have to do the screen sharing part again, sir. Just escape the button and for now, just again do the same thing. Just upload the slides and it will be best because on the screen it's not being showing the slideshow. As soon as you click on slideshow, it is showing blank. So there is a problem. Uh, all you have to do just don't click. Just click on presence. There, after clicking on present, you will see two options: slides and screen. You have to click on the slide button. Then click on slides. Then upload the slide.
Okay, it is getting update.
Okay, sir.
Updating.
Yes, sir. Viewers, sorry for this this issue. Please kindly wait for now. We will get you back as soon as possible. Just don't leave and just wait. Sir, it is being processed.
बोलो. हाँ, it is processing.
Or still processing. The network delays probably, sir.
Full.
Sir. Now you can just go through with this, sir. Now turn on
Okay.
your camera and you can just go through with the buttons, means up with the side buttons.
Increase.
Just while you're doing on the slideshow, like what you do on the slideshow with the buttons, you have to do the same thing with this here over here. To change the slide, you have to click on the keyboard button, sir.
Mm-hmm. Okay.
Okay, sir. Over to you, sir.
Okay. Thank you. So, so it is okay now. Orko.
Yes, sir. It's
Orko.
okay now. It's okay now, sir.
Okay. So, what nails say about the status of health? So, did you know your nails can reveal clues to to your overall health? A touch of white here and there of nail, a rosy ting there in the nail, some rippling or bumps may be sign of disease in the body. So significance of nail examination is essential for the purpose of diagnosis, for the purpose of the cause behind the disease, and that disease may be from each and every system of our body, each and every system of our human body, maybe from lungs, maybe from heart, maybe from kidney. So here is one quotation from the great Greek philosopher uh, Aristotle: "Pleasure in the job puts perfection in the work." Introduction. The nail is a specialized keratinized appendages found on the dorsum of each finger and toe. Good healthy nails are objects of admiration. The appearance and color of our nails not only reflect the status of our health but can give valuable information about the underlying disease conditions. Nail disorders comprise of 10% of all dermatological conditions. The aim of today's presentation on nails is about the status of health, reflection of systemic disease, and the related rubrics of nail abnormality. So here is the anatomy of nail. So you can see here the anatomical position of nail bed and different parts of nails. So here is the distal edge of nail plate, lateral nail fold, and this portion is known as lunula, and the edges of lunula is known as cuticle, and the upper portion of the finger aponychium. So under the nail bed, here is the nail fold, anterior ligament, aponychium, and this side the posterior ligament and nail matrix. How to examine a nails? So before examination, before palpation, we can see the color, shape, groups, lines, curvature of nail, because in case of clubbing, the curvature may be changed, and
Hello, sir. Hello, sir. Can't we see you, sir?
so can I stop camera?
Sure, sir.
Okay. So there are various types of nail diseases, nail complaints. Onychocystia, onychorexis, paronychia, onychomycosis, onychocysia, trachinichia, onychogryphosis, onychocryptosis, koilonychia, melanonychia, and leukonychia, etc. So now in our homeopathic repertory, there are so many rubrics on nail complaints, and that nail complaints may be related with the some vital diseases. So we first try to look the appearance of the nail. So here is the nail appearance. So in case of onychosegia, you can see these types of nails, the brittle fingernails, and you will find these rubrics in our repertory. Hand nails, brittle fingernails, and these are the medicine under these rubrics. And on high grade, you can find graphitis and sorinum. Homeopathic therapeutics, graphitis. Nails are brittle and crumbled. Nails deformed, painful, sore, thick, and crippled. Sorinum. Nails are brittle. So, what are the associated conditions if the nails are brittle? Excessive use of nail cosmetics. If a patient, if a lady, or if anyone uh, uses so many types of cosmetics, and these are mostly used by today's young ladies. So, due to excessive use of cosmetics, your nail may be brittle. Low water intake, eczema of fingers, hypothyroidism, and nutrition deficiency, maybe iron deficiency anemia, or maybe other causes. Onychorexis. So for onychorexis, you will find rubric in our repertory, that is hand, nails, corrugated. So here is corrugated nails. You see that nails are corrugated. So silicea and thuja is the medicine. Silicea and thuja. Nails are rough. Under silicea, you will find nails are rough, crippled, and brittle. And under thuja, you will find nails are brittle, ribbed, soft, distorted, and crumbling. Next rubrics: hand, nails, roughness, ridge, longitudinal. So here is the ridges are longitudinally. So hand, nails, roughness, ribbed, thuja, and fluoric acid. Homeopathic therapeutics, fluoric acid. Nails grow rapidly and awkwardly. Nails degenerate, deformed, rough, and longitudinally furrowed. Associated conditions: lichen planus, Darier's disease, rheumatoid arthritis, collagen vascular disease, systemic amyloidosis. So you know about the lichen planus. Lichen planus is a benign chronic mucocutaneous disorder that affects the skin mucosa, and nails. The occurrence of nail lichen planus has been reported to be about 10% to 15% of the cases, and 1.2% in case of children, and it is mostly affects the fingernails rather than the toenails. So lichen planus mostly affect the fingernails instead of toenails. Collagen vascular disorder, particularly systemic sclerosis, dermatomyositis, systemic lupus erythematosus, and mixed connective tissue disorder, are often characterized by microangiopathic abnormalities of the nail folds. Nail folds dermoscopy is well established technique to assess these vascular changes. Next rubric: hand, nails inflammation, phelon, onychia and paronychia. So here is the picture. You can see here that onychia and paronychia. The high-grade medicine are ammon-carb, anthraxinum, apis, diascoria, fluoric acid, hypersulf, nitric acid, silicea, and Tarantula cubensis. So the sub-rubrics are nail beginning in, root of, under, suppuration nails around. So with the sub-rubrics of nail beginning in hypericum, mercurius, phytolacca, silicea and sulfur, and for root of causticum and graphitis, and under the alumina, causticum, coccus cacti, sulfur, and for suppuration nails around myristica and silicea. Homeopathic therapeutics. Ammonium carb, big toe is painful and swollen, phelons in the beginning. Diascoria, phelons early when pains are sharp and agonizing. When pricking is first felt, disposition to paronychia. Silicea, phelons, abscesses, boils, old fistulous ulcers, inflammation around and under the nail, sensation as if the fingertips were separating, unhealthy skin, and every little injury separates. Associated conditions: secondary bacterial infection, fungal infection, and in case of diabetes mellitus also. Next rubric is hand, nails, fungus under nails. The medicines are antimicrobe, graphitis, nitric acid, sanicula, thuja, and silicea. Graphitis: nails are deformed, discolored, thick. Associated conditions: nail injury. In case of nail injury, you will also find this type of cases, these types of nails cases. Diabetes mellitus, ringworm of hand and foot, etc. So hangnails, you will get hangnail rubrics under the head main rubric. So here is two medicines only, natrum mur and sulfur. So here is the homeopathic therapeutics: hangnails for natrum mur, hangnails, dryness and cracking about fingernails, sulfur, cracks and hangnails. Associated conditions: trauma, may be due to trauma, dry weather, frequent hand washing, etc. Next rubric is hand, nails, thick. When your nail will be going to thick, you will find these types of thick nail. The medicines are antimcrude, graphitis, silicea, and astilago for thick nails. Homeopathic therapeutics, graphitis, and astilago. Under graphitis, nails are thick and rough. Astilago, painful and destructive disease of nails. Associated conditions are trauma, pachy, pachyonychia congenita, psoriasis, fungal infection, and Darier's disease. Next, hand nails thin. So the last slide was thick nails, and this is thin nails. Arsenic and opium. Arsenic album. Thin and paleness of the nails. Falling of the nails. Associated conditions: lichen planus, thyroid disorders, epidermolysis bullosa. Next, hand nails splits. So this is splits nails. Nails is going to divide in two parts, splits in two parts. Onychosegia, antimcrude and silicea. Nails are horny, brittle, and splits. Skin beneath nails painfully sensitive. Nails grow out of shape. So, what are the conditions? Overexposure to moisture, injury, picking and biting of nails, nutritional deficiency, folic acid and vitamin C deficiency, hepatic and renal diseases, psoriasis, and thyroid disorder. So in these conditions, your nail may be going to split in two parts or maybe some other parts also. So next rubric is nails spotted. So you can see here that nails are spotted at many places, as if uh, someone putting some types of with pins or some sharp materials, sharp instrument they are pitting on nails. So nails is spotted, nitric acid and silicea. It is known as trachynychia, or you can also call it pitting nail, pitting nail, or spotted nail. Homeopathic therapeutics, nitric acid is spotted and flaws on nails. Silicea, nails are spotted, rough. Fingernails, when cut, they are dry and brittle, half decayed and crumble to powder. It may be crumbled to powder. Associated conditions: in case of psoriasis, you will get these types of nail bed: alopecia areata, dermatitis, SLE, pemphigus vulgaris, etc. Pemphigus, pemphigus vulgaris. So now we are going to shape of the nails. I have discussed about the appearance of the nail. Now the shape of the nails. So these are the various types of shape. Onychogryphosis, claw-like fingernails. Claw-like fingernails. The high-grade medicine for claw-like fingernails is arsenic. So here is another picture. Arsenic album. Crumbling and deformed nails. Misshapen toenails. So this is another type of claw nails. Associated condition due to trauma or peripheral vascular disease. So due to peripheral vascular disease, your nails will be going to change into claws type, claw nails, deformed nails. So here is the clubbing. Hand nails carved. So here is another test. So this is the shape of normal nail bed, and this is the shape of clubbed nail. So when you touch your nail, if the middle portion of nail, you see here, the middle portion is touched with both fingers, and in case of clubbed nails, the middle portion is, there is few gaps that is unable to touch, and in normal position you can able to touch your both the nail, and in case of clubbed you are unable to touch your both the fingernails. So this is the test. So here is also normal figure. So normal is the 160 degree, the shape of the nail, and due to clubbing there is curve of 180 degree, and late clubbing, that is above 180 degree. Homeopathic therapeutics. Nitric acid. Nails are distorted, discolored, and curved. Yellow curved fingernails. So here is some picture of clubbing nails also. Here is the picture, clubbing nails. You can see here. So what is clubbing? So clubbing spelling is CLUBBING. So C means cyanotic heart disease, C cystic fibrosis, L lung cancer, L lung abscess, U ulcerative colitis, B bronchiectasis, B benign mesothelioma, I infective endocarditis, I. Idiopathic pulmonary fibrosis, N. Neurogenic tumors, G. Gastrointestinal disease. So these are the conditions. In these conditions, your nail may be clubbing, curved, or distorted or disfigured, deformed. So we are found these types of most of the cases of ingrowing toenails in our clinic. Onychocryptosis. It is known as onychocryptosis. Nails ingrowing. You will find nails ingrowing rubrics in your repertory book. The medicines are graphitis, magnum ostium, and tecurium. Homeopathic therapeutics. Oh, that is not magnum ostium. Magnetis polus australis. Australis. Ingrowing toenails and tecurium. Pain in toenails as if they had grown into flesh. Associated conditions of ingrown nail are if you wearing tight fitting shoes or repeated trauma to toenail. So here is the depressed nails. You see here the picture of depressed nails. So depression in middle of your nail. Here is maybe there is split or may not be split, but depression, you will see depression in nail. And rubric says complaints of depressed medorinum, and it is mostly known as coliconychia. Koilonychia. Homeopathic therapeutics, medorinum, transverse depression on nails as if they were bent, incurvation of nails. Associated conditions are iron deficiency anemia. Here is another picture, depressed nail, malnutrition due to celiac disease, Plummer-Vinson syndrome, thyroid disorders, diabetes mellitus, and in case of trauma also. So, depressed nail. So now we already discussed about the appearance, shape, and now the color. So, color of nails. So now the rubric you will find in our repertory book, that is the hand, nails, discoloration, black. The medicines are arsenic, graphitis, leptendra, natramure, and also one subrubric, that is nail around. Medicines is natramure, black nail or discolored nail. Homeopathic therapeutics, arsenic album. Nails are discolored, at first red, then black, later replaced by new nails, thin and transparent, black or blue nails. Graphitis. Fingernails are thick, black and rough, and matrix inflamed. Associated conditions: pseudomonase infection, sublingual hematoma, hemochromatosis. So these are the underlying causes of black nail. Hand nails discoloration, blood settles under nails, means clotted blood. Here you see that maybe there is blood clotted under the nail bed. Settles, blood settles or clotted blood under nails. So medicine says Apis mellifica, and it is known as melanonychia. Melanonychia. Homeopathic therapeutics: burning sensation in toes with redness, nails as if luge. The associated conditions of blood settles nail or blood clotted nails is the malignant melanoma, subungual hematoma due to acute injury or repetitive injury, splinter hemorrhage in case of infective endocarditis, trauma. So these are the conditions. So blue nail bed discolored and turned into blue nail. Cyanosis, it is known as cyanosis. So here is also one subrubric: livid, colchicum and oxalic acid. And the main medicines, the high grade medicines is Nux vomica and Veratrum alba. Veratrum. Blue discoloration of nails on account of coldness. So, in case of coldness, cold exposure, your nail may turn into bluish. Then you can think for the Veratrum album. Cold exposure, congestive heart disease, Eisenmenger syndrome, methemoglobinemia, Raynaud's phenomenon, etc. So now next, the color, nails discoloration, gray. So gray color, here is the gray color nail. Silesia. Nails are gray, dirty, as if decayed. When cut, scattering like powder and splitting into layers. When cut, scattering like powder and splitting into layers. Gray nails. The associated condition of gray nails are nutritional deficiency and due to fungal infection. You can see here the gray color. Here is the gray color. So now the red color. Hand nails discoloration, red. Arsenic, crotellus, lithium carb. Soreness of nails with redness. If there is soreness and redness, you can think for lithium carb. Associated conditions are polycythemia vera, lupus, carbon monoxide poisoning, angioma. So in case of angioma, carbon monoxide poisoning, lupus, and polycythemia vera, the nails may be turned into red color with brittles also. With brittles also. So now white nails, hand nails discoloration, white, cuprum and nitric acid. So you can see here the nail is completely turned into white. White. Terige nail. So what is in terige? Some portions are white and some portions are normal. You can see here some portions are turned into white and some portions are normal, looking normal. So what are the conditions? Congestive cardiac failure, diabetes mellitus, cirrhosis of hepatic cirrhosis, or in case of CRF, chronic renal failure. Terige nails. So here you see half and half nail. Half and half nail. So half portion is normal looking and half is turned into white. This is also known as Lindsay nail. Lindsay's nail. So in case of chronic renal failure, you will find these types of nail. So the rubric is white, white spots, nitric acid and silicea, and the associated conditions are repeated and vigorous manicuring. Those are repeatedly done manicuring, the treatment of nail with manicure. Nutritional deficiency, that is zinc deficiency and calcium deficiency. Sickle cell anemia. So in case of sickle cell anemia, the color of nail turns into white, or maybe there are some white spots. So here is the white spots. In case of sickle cell anemia, here is the white spots. White spots. Okay. Homeopathic therapeutics, affections of fingernail, especially if white spots on nails, crippled nails, nitric acid nails are discolored and white spots present on nail plates. Next, nails discoloration, white and white stripes. So here is stripes also, white stripes. White stripes. Meese line. It is also known as Meese line. The medicine is thallium. And underlying causes are chronic arsenic poisoning, chronic renal failure, sometimes after chemotherapy. So after chemotherapy, you will get also these types of nails, that is white stripes nail. White stripes nail. Murex lines. Murex lines. So here is Murex lines. You can see here Murex lines. So 3 lines here. 3. In case of chronic hypoalbuminemia, Hodgkin's disease, chronic renal disease, and pellagra. murex lines, thallium, discolored and deformed nails. Now the yellow nail. Homeopathic therapeutics, conium, finger nails are yellow, sepia, discolored nails and yellowish brown spots, Marxol, yellow discoloration of nails and skin, nitric acid, yellow stripes on the edges of nail. So this is also yellow nails. And associated conditions is jaundice, fungal infection, psoriasis, diabetes mellitus, lung disease like emphysema, bronchiectasis, etc. Nail health chart. So here is the nail health charts. What will we do for uh, healthy nail? So here is the nail health chart for issues like brittle nails, frequent wetting and drying, common cause, and treatment options is apply lotions containing alpha hydroxy acids or lanolin, and issues like soft or weak nails and due to overexposure to moisture or chemicals. The treatment options is keep nails natural and unpolished. Consider taking a multivitamin containing B vitamins and calcium. And if frequent peeling, injury, common cause is injury or iron deficiency, keep nails moisturized. Add iron-rich foods to your diet. Ridges, in case of ridges on nail, vertical or underlying condition is vertical aging. Gently buff nails, talk with a healthcare professional. So in case of ridges, look like the nail look like a aging person. So we can consult with the health professional. So how do I keep my nails healthy? Our bodies are smart, so when we are low in vitamins and minerals, our nails and hair will show it. So this is one of the famous health expert on nail only, Norris, Madam Norris, and these are the her advice. Eating a variety of whole foods, fruits, vegetables, whole grains will usually get you all the vitamins, minerals, and nutrients to your nails. You can also take multivitamin, and she is also advised for biotin and horsetail supplements for the healthy conditions of nails. So those are in the business of beauty treatment. So they are using these types of treatment. They are using this type of treatment, and the biotin is the vitamin B7, and horsetail is a supplement, is a plant source supplements. Horsetail. So here is one study. There are so many studies on nails. So here is a study. This is the current studies uh, in Morocco, and these are the persons they have studied in the Department of Dermatology, Hassan II University Hospital Center, Fes. in Fez city of Morocco. Study was on 70 patients, 34 men and 36 women, a total of 56/70. So in 56, that is 80% patients are found with ungual abnormalities. Means the various types of nails complaints. So in renal failure cases and study of nails, the study was done at Morocco in the Hassan II University's Hospital Center, and they are found that 56 cases, 80% out of 70, 56 six cases are nail deformity in case of renal failure. So here is some cases from NIH. Here is some cases from NIH in our hospital. So the complaint of difficulty in breathing for last 2 years, exertion, talking loud, stiffness in opening mouth for last 6 years in winter night. So this is the case, and here I am showing this is the lady. So here is a thick nail, thick and deformed nail. You can see here. I am not describing this case in full length, just showing you the nail of that lady. So this is our IPD, and this is the nail of that patient, that lady, and this is the toenails. Here is also depressed nails. Case number 2. You can see the thin nail, thin and white nail. Thin and white nail. So picture was taken when the patient was sleeping on bed. Okay. And this is also from our IPD, a case of CKD. Patient is under female ward, Smith RS, and chronic kidney disease. And this is also type 2 insulin dependent patient. And here is one, maybe we are treating this case a few days back. He was admitted in our male ward. So this is the nail condition. White nail. White nail. So now the conclusion. Nail changes are reflection of turmoil in the internal dynamics and important to understand health condition or underlying disease condition. In all cases, nail changes cannot be considered as indication for a particular medicine. But in some cases, it may be the indication for choice among competent similar medicines. A thorough case taking is needed in every case. Sometimes nail changes can act as keys to open the big locks of chronic cases. So we should consider also the examination of nails, and if we will find some abnormality in nail, we can think over the underlying causes. So here is the references. So thank you very much for patience hearing.
Thank you, Professor Birendra Srivastava, for his nice and elaborate descriptions regarding the nails. What nails say about our health. He's a man of the repertory, and he's nicely described the repertory from the repertory point of view, also the therapeutics, including the descriptions of the nails. And so this audiovisual mode definitely impacts more than the simple audiological mode. However, thank you very much for your vivid descriptions and deliberations regarding the status of the nails. So, if I just make a summary of the so far the deliberation has been made, we know that nails definitely reflects the internal turmoil which is going on within the dynamics of our body. If we just view the nail from the standpoint of the practice of medicine, definitely general survey is very, very important. So when we examine a patient from head to foot, it definitely includes the nail and also the other appendages of the body. Clinical examinations and observations are key to a homeopath. At one hand, it helps in the diagnosis. Definitely, it leads or gives some clue regarding the diagnosis. And on the other hand, it helps in knowing the persona of the individual, that is the personality test. So the individualizations can be met. We know most of the nail changes are chronic in nature or the reflections of some chronic disease which is going on in the interior. So whenever the chronic disease is concerned, definitely the cause of the chronic disease, that is the miasms, come into the fore. Hahnemann himself and also later on Dr. J.H. Allen described that the nails are not to be discarded because these nails oftentimes reflects the internal miasmatic discretions or the predominating miasms which is prevalent at that particular time in the patient. If we just overall consider the different nail changes, we can see that the nails are affected in different ways. Some nail defects are definitely result from the birth deformities. Some nail disorders are related with the systemic diseases, and some deformities and dystrophies are associated with the skin diseases. So far, Dr. Shah has described. So, nail changes are surely reflections of different miasmatic discretions of the body. If we just consider from the slides that have been already displayed by Dr. Birendra Srivastava, that some nails are very dry, some nails are thick, some nails are thin, some are broken. But all these things definitely have some definitive miasmatic discretions which are going on in the background. Usually, the sodic nails are dry and harsh in appearance. Nails are oftentimes very brittle and breaks easily. On pressing the tip of the nail beds becomes very pale or anemic in appearance. These are the overall features of the sodic nails. Whereas psychotic nails may be thin, but mostly it is thick and rigid. And as a result of the hyper or excessive depositions of the tissues, the psychotic nails are usually wavy, corrugated nails, and have some bumps and protuberances. They are oftentimes very, very irregular, and thick edges are there. So psychotic nails has got some their reflections. On the other hand, the syphilitic nails, definitely, syphilitic nails are also thin as paper. They break easily, bend easily, as if they are losing or are deficient of some nutrients. Their brittleness is also there. Sometimes these nails become spoon-shaped. That is the colonychia that have been nicely displayed by Professor Srivastava. So natural convexity is reversed. Normally the natural convexity is there, but it becomes concave in the center, and that's why it's a colonychia develops. Pitted nails are also a reflections of the syphilitic nails. Pitted nails are oftentimes seen in the psoriasis, in the lichen planus, and in many other systemic conditions. So longitudinal or transverse indentations are also expressions of some syphilitic dyscasias. Professor J.H. Allen added another point in relation to the miasmatic deliberations, that is tubercular threats or tubercular diathesis. We know oftentimes it is normally called as tubercular miasm, but I must not go into that controversy, because miasms are only three as per the Hahnemann has stated. It's a broader classifications. Tubercular is a trait, or tubercular diathesis is there. Tubercular diathesis has its own presentations. Say, for example, if there are developments of the paronychia, or if there are recurrent infections in the nail bed, or pustules are there, all these belong to these tubercular traits. Tubercular nails are oftentimes very similar to that of the sodic presentations, but with some syphilitic punch in the background. Because the tubercular traits develops in the combinations of the sora with the syphilics when they pass through the generations. It's not developed in the first generations, but when the second generations, they pass through the generations, the bond becomes inseparable bond. And that's why these tubercular traits are very, very important. But when we discuss the nail drops or pustular inflammations or pediosteal inflammations, all these things belong to these tubercular nails. But in today's world, a single miasmatic dyscrasia is almost a theoretical absurdity, because you can't expect a body or a human being to be affected with a single miasm. Because today, single miasmatic presentation is almost absent, and there is a multiple miasms are there. But overall, when the multiple miasms are present, single miasm always becomes a predominant miasm, and most of the symptoms, that is the present complaints, flourish from the predominating miasm, and we have to treat accordingly. So I must not go into the further details. The repertorial portions and therapeutic portions of the different nail deformities have nicely been described by Professor Srivastava. And with this, the first sessions of this, I must conclude that it's a nice presentation, and we have enriched ourselves with these audiovisual presentations of Professor Srivastava. So we now moving on to the second session. So our second speaker regarding the CME of the National Institute of Homoeopathy, Dr. Jhanwar. He will be speak or present upon the mental diseases and homeopathy. So I request Dr. Jhanwar to be ready and present his deliberations. Over to Dr. Jhanwar.
Good evening, everyone. Myself, Dr. Jhanwar from 21st batch of NIH BHMS. So this is my first.
Sir, please, your internet is being delaying for some reason. I don't know why, but your audio is not clear, sir.
Hello.
Yes, sir. Now it's clear.
Good evening, everyone. This is Dr. Jhanwar from Rajasthan and 21st batch of UG BHMS NIH. So this is my first session in this CME, and today I am discuss about mental disorders. I will discuss classification of mental disorders, uh, both internationally or uh, by homeopathically. So first, we will discuss the classification of mental disease internationally. So according to WHO, what is mental disorders? Mental disorders or mental illness are the result of disturbance of psychological functioning due to various reasons. This is the official definition for mental disorders. Actually, the disorder word is indicating the disturbance in the functioning. That's why we called it mental disorders. Now we are discussing about classification of disorders. That international classification of disease, we can say ICD. So according to ICD-10, which are currently classify the disease and which is developed by the WHO. The ICD-10, the current version being followed is the 10th version of ICD. And ICD-10 is developed by the WHO, published in 1992. The ICD-10 follows an alphanumeric coding scheme based on the codes with a single letter followed by two numbers at the three characters level, A00 to Z99. And there are total 21 chapter of in ICD-10. And in this chapter number 5 of ICD-10 deals with the mental and behavioral disorders, and has 100 categories, which started from F00 to F99. So we will discuss about uh, first first category, which is F00 to F09. Is described about organic, including symptomatic mental disorders. And later, from F10 to F19, we will be discussed mental and behavioral disorders due to psychoactive substance use, like alcohol, opioids, drugs. Due to uh, due to use this kind of substance, the mental symptoms appears and the disease happens. After that, F20 to F29, the schizophrenia, schizotypal, and delusional disorders. And in next group from F30 to F39, it's described about mood affective disorders. And then we will we'll move next from F40 to F49, that neurotic, stress related, and somatoform disorders. And this is the fifth group. After that, we'll move from sixth group that F50 to F59 is described about behavioral syndromes associated with physiological disturbance and physical factors. And after that, from F60 to F69, ICD described about disorders of adult personality and behavior. And then next is from F70 to F79, it's about mental retardation. And from F80 to F89, it's the disorders of psychological development. And after that, from F90 to F98, it deals with behavioral and emotional disorders with onset usually occurring in childhood and adolescence. And the last one, F99, which describe about all other mental disease which are not grouped in all above. So that is the 11th group of this chapter. So first of all, we will discuss about the first group, which is F00 to F09, that is organic, including symptomatic mental disorders. So these kind of disorders, which grouped in, which comes in this group, it's also known as organic brain disorder. It's characterized by a demonstrable etiology in the brain in form of a cerebral disease, injury, or some other insult leading to cerebral dysfunction. And the illness may be primary, where the pathology involves the brain directly, or secondary, where the brain is affected as secondary consequence of another systematic disease. For example, brain is primarily organ involved in Alzheimer's disease, Parkinson's disease, head injury, or cerebrovascular accidents. And the secondary involved in diabetes mellitus, hyperthyroidism, hypothyroidism, HIV infection, and nutritional deficiencies. So all these type of diseases are grouped in these first group, which is F00 to F09. Let's move next group, which start from F11, F10 to F19. This is about mental and behavioral disorders due to psychoactive substance abuse. As I told you before, that the psychoactive substance like drugs, alcohol, opioids, after abusing these kind of substance, the disease arises, which comes in this group. Abuse of various psychoactive substances like alcohol, opioids, stimulants, or other such substance can result in a wide variety of psychoactive conditions, such as acute intoxication, dependence syndrome, withdrawal phenomena, amnestic syndrome, and disorder resembling functional psychiatric disorders like schizophrenia, depression, mania, amnestic syndrome, etc. So these all are described in this group. Now move towards next group, which is F20 to F29. It's about schizophrenia, schizotypical, and delusional disorders. This group includes schizophrenia, schizotypal disorders, persistent delusional disorder. So if we talk about schizophrenia, the schizophrenia is characterized by disturbance in thinking, emotion, perception, behavior, and personality disorganization. And in this condition, the patient may present with delusions, hallucinations, disorganized thinking, disorganized behavior, and personality deterioration. Next, delusional disorder. The patient present with long-standing delusions in the absence of any other characteristic, psychopathology, suggestive of schizophrenia, mania, or any other psychiatric disorder. So this groups about these kind of uh, diseases. After this, we'll move next group, which is F30 to F39. This is mood affective disorders. These kind of disorders are characterized by a primarily disturbance of mood or effect. Most of the other symptoms are secondary and can be easily understood in the context of the primary mood disturbance. Most of these disorders run as an episodic course. These episodes can be mania, depression, or of mixed type. In inter-episodic periods, patients may not have any symptoms. Or in depressive phase, the patient feels sad, dejected, and low. There is a loss of interest in day-to-day activities, decreased sleep, decreased appetite, and lack of energy. So these all are described in this group. Now we are moving next group, which is F40 to F49. This is neurotic stress-related somatoform disorders. These group of neurotic stress-related and somatoform disorders included a large number of conditions. Most such patients present with anxiety symptoms or somatic symptoms without an organic basis. Stress-related disorders like post-traumatic stress disorder and dissociative disorder also grouped in this broad category. So this was the fifth group of this chapter. Now we are moving in sixth group, which is F50 to F59. In this group, we will study behavioral syndromes associated with physiological disturbances and physical factors. This group, including eating disorders, non-organic sleep disorders, sexual dysfunctions, mental and behavioral disorders. So these kind of disorders are comes in this group. Eating disorders include anorexia nervosa, bulimia nervosa, overeating, and others. Anorexia nervosa is characterized by deliberate weight loss induced or sustained by the patient and usually seen in adolescent girls and young women. Sexual dysfunction or psychosexual disorders include a range of dysfunctions like failure of genital response, premature ejaculation, and retarded ejaculation, excessive sexual drive, lack or loss of sexual desire, or sexual aversion. These all kind of disorders are comes in this category. Now we are moving next group, which is F62, F69. Disorders of adult personality and behavior. This group includes personality disorders, habit and impulse disorders, gender identity disorder, orders of sexual performance, and factitious disorders and other related disorders. In personality disorders, these are the significant functional impairment, and the patient may be subjectively distressed but denies his or her problems and refuse psychiatric help. So these kind of symptoms comes in personality disorders. Now we are moving next group, which is F70 to F79. It's about mental retardation. Mental retardation is a development condition characterized by significantly sub-average intellectual intellectual functioning in the various areas like cognitive, language, motor and social abilities, resulting in the associated with concurrent impairment in adaptive behavior. It is characterized as mild, moderate, severe or profound. Now we are moving next group, which F80 to F89, the disorders of psychological development. This group includes specific developmental disorders of speech and language and scholastic and motor function, mixed specific developmental disorders, and pervasive developmental disorders. So these kind of disorders are comes under this group. Next group, which F90 to 98, is about behavioral and emotional disorders with onset usually occurring in childhood and adolescence. This group include hyperkinetic disorders, conduct disorders, mixed disorders of conduct and emotions, emotionally disorders with onset specified to child, and disorders of social functioning, neurosis, neuroprasis, and the other related disorders. So these kind of disorders are comes under this group. And the last, the F99, it's about unspecified mental disorders, which are not included in all above that group. So these all 11 groups are there in ICD classification, International Classification of Disease 10, which is currently running by WHO. So it was the international classification. Now we are moving toward homeopathically classification. So in homeopathic classification of the disease, first, what is mental illness or mental disease according to homeopathy? So we'll, according to homeopathy, mental disease. Mental diseases are the one-sided diseases affecting the whole psychosomatic entity, where the symptoms of dearrangement of mind and disposition is increased while the corporal symptoms decline. Like all other one-sided disease, they are soric in or origin. So according to homeopathy, mental diseases are the one-sided diseases. It means one-sided diseases means it's having very few symptoms. So these kind of mental diseases having not too much symptoms. So it affect the psychosomatic entity, and they uh, uh, they are soric in origin. So their treatment should be antisoric according to homeopathy. So if we are so now we are going what is the classification according to homeopathy? How many types of mental disease is there. So here the classification of mental disease. So our master Hahnemann has classified mental disease into four types. Uh, the first is the mental diseases appearing with the decline of corporal diseases, which is threats to be fatal somatopsychic type. It's the first type. The second is mental diseases appearing suddenly as an patient's ordinary calm state caused by some exciting factor. And the third is mental diseases of doubtful origin. And the last one, the fourth, mental diseases arising from prolonged emotional causes, psychosomatic type. So these four types of uh, diseases, according to homeopathy, according to our master Hahnemann. So we'll discuss. We are going to discuss about first type, which is mental diseases appearing with the decline of corporal disease, which threats to be fatal somatopsychic type. So as it's described, that decline of corporal disease. Corporal disease means that physical disease which having with symptoms, we can see the symptoms. So after decline of these physical symptoms, the mental symptoms arises. So this in this category, corporal disease will be declined. So in this type of mental diseases, the so-called corporal disease decline with a rapid increase of psychical symptoms that were previously present. And in short, the affection of the grosser corporal organs becomes transferred and conducted to the almost spiritual, mental, and emotional organs, which the anatomist has never yet and never will be reached this spot. Means the symptoms arises from corporal organs, which like or lungs, kidney, liver. Their symptoms slowly decline, and they all are transferred into mental symptoms and towards brain. Uh, so these kind of transfer occurs in this type, and we'll talk about if we talk about treatment about this type. So for the treatment of these kind of diseases, we should make a complete picture of the disease about adding all the symptoms which were previously that corporal symptoms also. Corporal symptoms are not gone fully, so some symptoms is still there. So we should take those symptoms also, and we should make the complete picture of the disease. And after that, uh, as I told you earlier, that it's psoric in origin. So we should take treatment anti-psoric by anti-psoric medicine. So this kind of diseases, uh, treatment should be anti-psoric after adding all the symptoms. Now we are moving next disease, next class type of disease, mental disease. The mental diseases appearing suddenly. Mental diseases like insanity or mania may suddenly break out as an acute disease in patients' calm state from fright, vexation, and abuse of spiritual liquor, extra. So, in this type of mental disease, this suddenly appears from some exciting cause or like from fright, etc. So these kind of diseases comes in this classification, and how to treat this kind of medicine, so this kind of diseases. These cases should not be treated immediately with antisoric medicine, but in the first places, they should be treated by administering highly potentized, minute homeopathic doses of proved acute medicines having similar mental state in their pathogenesis. So this type of diseases should not be treated immediately with antisoric medicine. We should give some acute medicine first. This will revert SORA to its former latent state for the time being, and the patient who has recovered from an acute mental and emotional disease by the use of these non-antisoric medicines should not be regarded as entirely cured. So firstly, we have to treat with non-antisoric medicines. It's revert the SORA to its former latent states, and after that, we have to treat with in the last we have to treat with antisoric medicines to complete cure. After that, we are moving third third type, the mental diseases of doubtful origin. So there are certain mental diseases where it is difficult to ascertain whether they are really arise from corporal affection or from psychological factors. For example, fault of education, bad practices, corrupt morals, neglect of the mind, superstition, or ignorance. So, in this kind of mental diseases, we are not sure about the origin. So, how to treat this kind of mental disease? So, if the mental affection is of the soric origin, uh, we just taking the symptoms, and after taking symptoms, we thinking that maybe it's from soric origin, and the symptoms indicating that that their mental affection is of soric origin. Then treatment should be done as the mental diseases arising from the prolonged emotional disturbance. So this is the fourth type, mental diseases arising from the prolonged emotion disturbance. So if mental affection is of the soric origin, then we have to treat uh, uh, treatment should be taken for same similar to the treatment which done in mental diseases arising from prolonged emotion disturbance. We'll be discuss next slide about these treatment. And the second one, if the mental affection is of bodily origin, means uh, mental affection is from corporal diseases, corporal symptoms, then treatment will be same as of the mental diseases arising from the corporal disease. The first type of the mental disease, the mental disease arising from the corporal disease, that the same treatment should be given in these type. Antisoric medicine will should be given in this kind of treatment. So this was about mental diseases of doubtful origin. Now the fourth one, the fourth classification, which uh, which is mental diseases arising from prolonged emotional causes, psychosomatic type. So this is the last classification. There are a few emotional diseases which originate and kept up by some emotional causes, such as continuing anxiety, worry, vexation. wrong, and the frequent occurrence of great fear and fright. So, as uh, it's saying itself that arising from prolonged emotional causes. So, due to prolonged continued anxiety, worry, vexation, wrong, and the frequent occurrence of great fear, after continuing these kind of symptoms, the mental disease arises. So, these kind of diseases, how to treat homeopathically? For this kind of treatment, the psychotherapy and appropriate diet and regimen should be given. This is psychotherapy is very necessary for this treatment, and to prevent recurrence, which might antisoric treatment readily occur. So, to prevent recurrence of these kind of disease, we should treat this from antisoric medicines, as the mental diseases are soric in origin. So, due to complete cure these type of diseases, we should uh, we should give treatment of anti-soric medicine. So these all are about the classification of mental diseases, which uh, from ICD, International Classification of Diseases, and the other was the homeopathic classification of mental diseases. So I tried my best. This was my first CME. If any mistake will be there, then I'm really sorry for that. So, thank you.
Thank you very much, Dr. Jhanwar. It was a lucid and very nice presentation. It's a vivid descriptions regarding the classifications that you have met regarding the ICD-10 classifications into the 11 groups, and as well as the Hahnemannian classification of mental diseases and their treatment thereon. So far mentioned in the Organon of Medicines, and we know it's a Bible of our to a homeopath, the Organon of Medicines, and also the chronic disease. Yes, you have nicely described. Um, I am before going into further detail. There is a question for you from the audiences, the participants. What are the roles of homeopathic treatments for body dysmorphic disorder? What are the roles of homeopathic treatments for body dysmorphic disorder? And the question has been forwarded to Dr. Jhanwar. Please be with us. Hello. Dr. Jhanwar,
Dr.
are you?
Jhanwar, it's a question for you. Orko, is Dr. Jhanwar in the studio? So can we go on to the second question in between for Dr. Srivastava?
Okay, Dr. Srivastava is here.
Uh, it's up to Orko. Orko, is Dr. Srivastava here? Yeah, he's there.
Okay, okay. Professor Srivastava, a question from the audiences. What are the treatments of persistent nail infections after failing top-grade homeopathic repertorial miasmatic remedies? What are the treatments of persistent nail infections after failing top-grade homeopathic repertorial miasmatic remedies?
There might be network issues with Dr. Srivastava and Dr. Jhanwar. I request backstage editor Orko, can you help us with whether we had been able to establish connectivity with Dr. Professor Srivastava?
Sir is being yet to join, not joined.
And Dr. Jhanwar?
Neither. As soon as they come, I will take them up on screen.
Okay, okay. Dr. Arijit, let us wait for some time. In
Okay.
between the if they are not getting the connectivity, if possible, sir, you can answer these questions. It has
Okay.
been asked by Probir Majumdar.
Yes.
Uh, Two questions to both the speakers. Uh,
Okay.
with your permission, sir, can we promote our alumni
Surely,
meet?
surely, surely, Dr. Bidyut.
So so
Here.
that we are waiting for both the speakers tonight. Both
Okay.
of them are there. Okay, okay. The speakers are here. Over to you, sir. Dr. Srivastava and Dr. Jhanwar. The question again, please.
The question to Dr. Jhanwar: what are the roles of homeopathic treatments for body dysmorphic disorder?
They are yet to come. They are yet to come. They
Okay.
have
Okay,
not
okay.
joined yet.
Then,
Dr. Srivastava is here.
I think Dr. Srivastava or Dr. Kalyani is here. Okay, okay.
Dr. Kalyani is here.
Anyway,
Okay. Okay.
uh,
You proceed with your promotions. Okay. Yeah.
thank you, sir. We are sorry for the network connectivity with both the speakers tonight, and being a festive day on the occasion of Lakshmi Puja in West Bengal and in the other parts of the country. So people over here are busy at the domestic front too. But we have some exciting announcement to make, and that's this is a part of Dr. Pralay Sharma, who is now probably by the side of his ailing mother at NIH Hospital. Pray for her speedy recovery. In between, our alumni meet, we are all eagerly waiting to meet face to face after so many years. And the old pals will be meeting each other. Like today, I had been lucky to be with our beloved Dr. Kalyani sir, and by grace of God, we made a connectivity with his batchmate after 40 years on video call. So this is something unique and extraordinary. The old nostalgic feelings of the college days, whatever be the age, you might be 25 or you might be 55 or 75. All are excited from all parts of the country. We are getting calls day in, day out from every corners of the country, even from abroad. Few people are coming from abroad, from Sri Lanka, from Canada. So we are eagerly waiting. Come up, join us on 9th of December at NIH. And the rest part, I think Kalyani sir will be delivering on his concluding speech. In between, there is another exciting news. In this CME, we are trying to connect how many people? Only two speakers, a moderator, and from the faculty or from the alumni, one inaugurator. We are connecting four people, apart from myself, Kalyani sir, Dr. Pralay, some days Dr. Ampriya in the back office. There are a lot of people who are working, like Dr. Chandrasekhar Pore, Dr. Kishore, and many are there. Dr. Sridip Sarkar, Dr. Ramkrishna, and a lot of people, Dr. Gautam Pal, Silent Crusaders. So these are people who are working day in, day out to make this CME a grand success. But we are having another platform now. We'll be having our e-journal, which will be published every quarterly. That is, on every fourth month, we'll have a e-journal. Who will be the writers? It's you, me, and all of us alumni of NIH. They will be the writers. We'll be sharing our experiences. And that team is being led by our renowned Dr. Ishwaradas sir, being the chief editor. But the heart, the nerve of this e-journal are again our two dynamic personalities who prefer to work behind the scenes, Dr. Chandrasekhar Pore and Dr. Mohammad Naeem. These two dynamic persons are making calls day in and day out across the country, trying to unite a lot of people. I had been with them every day, and every day they are calling 30 odd persons, alumnus across the country, and making a minimum call of 3 to 5 minutes makes up, you can count up 150 minutes, 90 minutes to 150 minutes a day. They are working to make a united alumni front for NIH and to make that alumni meet and the e-journal project a grand success. So please come forward. Never hesitate to give your writings. Mail it directly if you have the number of Dr. Chandrasekhar Pore or Dr. Muhammad Naim. It's already been shared in the group of WhatsApp and Telegram of Alumni Association. Moreover, you have NIH Alumni Association email ID. If you don't have their number, send your articles to nihalumnimeet@gmail.com. It will be sent to the editorial board, and there will be the final judge which articles, how much edition, how much alteration need to be done. And we are having a dream to make it a peer review journal with the stalwarts on the nerve, heart, and the brain of this journal. The names like Professor Chaturbhuj Naik, Dr. Patanaik, leaving aside our beloved Dr. Kalyani sir, Dr. Sunimal Sarkar, Dr. S.Z. Khan, Dr. Professor Samir Bhattacharya, and many more. So all these people, apart from the young generation, Dr. Rajat Pal, Dr. Kishore, Dr. Partha Pratim Roy, the future stalwarts, and all these people who have been silently backed up and supported by Pralay, Dr. Pralay Sharma, Dr. Srideep, Dr. Ompriya, and so many, so many. Dr. Sapan Pal, I might not be naming all, I might be forgetting. Please forget me. But it's a united team project which we should carry forward. And it's a request to all of you. Please come forward and join us, and so that we can make the alumni meet a grand success. Today we had a meeting for
Maybe some network issues. Please hold on till then. They are trying to get back to him. Just hold on for a moment. Maybe there is some connectivity issues over here with BSNL broadband we are using currently. So please just a minute.
sorry, extremely sorry for the network delay. Uh, so uh, it's a teamwork. I was telling about Suman Haldar, who is designing the website, and we'll be having a grand alumni meet not only this year. The team NIH Alumni Association will be working for the benefits of homeopathy at large. Over to you, our moderator, sir, Dr. Arijit, sir.
Thank you, Dr. Bidyut Mukherjee. Whether Dr. Srivastava and Dr. Jhanwar has already been connected or not. Orko, whether they have joined. I think they are yet to join.
Sadly, no, sir. As soon as they will be joining, I will be bringing them up on the screen.
So, sir, if you can answer the question on behalf of them, please.
Okay, I'm just trying because actually I'm not so prepared. Okay, still, the first question was, I think it was, yes, what are the roles of homeopathic treatments for body dysmorphic disorder? Actually, BDD or body dysmorphic disorder, it's a psychological condition of the patient. The exact etiology of this body dysmorphic disorder is not clear. the patient oftentimes feels that they are looking not so good as is expected. They have some problems with their images. They oftentimes goes in front of the mirror, check their facials, check their faces or faces, their appearances, their shapes of the body, everything. They feel that there are some problems with their appearances in the society, or someone is looking badly towards them. The exact etiology is not clear, but still, some of the causes which are oftentimes associated are actually there may have some family history with this BDD or body dysmorphic disorder. Sometimes there are some negative evaluations regarding their, or some negative experiences that they have faced in their lifetime. However, and sometimes it is associated with some abnormal brain functions or abnormal levels of chemical balances of the brain. So we have to first evaluate what are the nature of the causes. Actually, it depends upon whether it's a curable or not. The first thing, the curability is the factor which is very, very dependent upon the prognosis of the treatment. So whether it is treatable with the internal medications or not, or whether it has reached to that degree where from it cannot be only cured by medications, it's very, very difficult to assess. But there are some risk factors. There may be certain factors which are very, very important, which ultimately leads to this BDD or body dysmorphic disorder. Mm, these body dysmorphic disorders, there may be some societal pressures, so certain personality traits, maybe their negative life experiences, like childhood teasing, neglect, or abuse. When this neglect and abuse are persistent for a prolonged years, sometimes often there becomes irreversible changes, and so they cannot be uh, turned to be a normal individual with the medications. However, if they are reversible in nature, then with the lifestyle changes, with some the Hahnemannian process of the psychotherapy, which has been nicely described by Hahnemann, the friendly exhortations, the sensible advices, the moral boosting, everything can be given along with some very well selected homeopathic medicines. Then you can't say beforehand that it's a curative medicines, because you should always judge by the result. But be careful, don't go for any higher potency with deep acting medicines or repeated doses, because if it is done, then these conditions may aggravate and may ultimately becomes much more furious in, or other psychological problems may develop. That much is to be said. So homeopathic medicines and BDD, these are actually it can be treated, but within certain limits. But during BDD, some psychological counseling, moral boosting, and some friendly advices, sensible advices, all these things are to be corroborated at the same time. This much about the BDD. And the second question was, I think, regarding the nail disorder, I think. The treatments of persistent nail infection after failing top grade homeopathic repertorial miasmatic remedies. Uh, Actually, top grade homeopathic repertorial miasmatic remedies, it does not mean it's a similimum, because homeopathic top grade remedies which we get after repertoire additions, it's a just it gives us a, or it simply narrows the field of selections, but it usually never selects the similimum. So that is the first thing, because when there is a failure after application of a remedy, we must look upon ourselves instead of blaming others, instead of blaming the patient, instead of blaming the nature of the disease. We must first direct the arrow towards ourselves. What was our fault, or whether there was any fault to ourselves. So we must reassess the case properly. This is the number one. Number two, there may be some blocks which may act as a hindrance in the actions of the medicines. Well selected medicines oftentimes fail. So we must consider the blocks or any hindrances are there in the path of recovery, or is there any maintaining causes. So a persistence of the maintaining cause must be removed first in order to get the benefits of the simillimum. So all these things are to be considered. Above all the conditions may not be curable. So except a chronic infections with some developments of chronic granulation tissues, which may not be curable with some internal medicines. So in spite of giving the best selected remedy after repertory or repertorizations with high-grade miasmatic, high-grade epithelial selections with miasmatic background, when everything has yet been considered, but still the remedy may fail because the condition is irreversible. So all these things are to be kept in mind. So we must reassess our process of selections of the medicines. We must retake the case. We must look into the pros and cons of every possible corners of the case taking or the case reports, whether there are any maintaining causes are still acting behind. It may be some habits, it may be use of certain cosmetics, or it may be the occupational hazards of the patient, whatever it may be. So we must have to look into those factors before going into the treatment further. Thank you. Now, I am just making a summary of the presentation of Dr. Jhanwar. Yes, he has nicely presented the International Classification of Diseases 10, which has been grouped into 11 groups, and also the Hahnemann classifications into the 4 groups with their treatment proper. So these are the different conditions of the mind. There is the one-sided diseases, he has nicely been explained, which are responsible. Actually, WHO, besides making or considering or acknowledging these ICD classifications, they have grouped a broader classifications. They have made a broader classifications of mental disorders. These broader classifications are very clinical orientations. Actually, these ICD classifications are very, very important for some academic interest. Those who are doing post graduations or MDs in psychology, definitely it's very, very enrichment for them. But for the people or for the general practitioners, such type of classifications may not be helpful in clinics. And that's why the WHO has brought into some broader classifications. These broader classifications are like this: the anxiety disorders, the first classification. Number 2 is the depressive disorders. Number 3 is the bipolar disorders. Number 4 is the PTSD or the post-traumatic stress disorders. Number 5 is the schizophrenia or schizophrenic disorders. Number 6 is the eating disorders, different types of eating disorders. Number 7 is the disruptive disorders and dissocial behavior. And number 8 is the neurodevelopmental behavior. So all these classifications are simply, very simple and easy to remember. With due respect to the modern medicines, with due respect to the WHO classifications, we, as a homeopath, while treating the patients in clinics, we should also remember side by side or must pay gratitude to Hahnemann, because the classifications of Hahnemann are still prevalent today. Say, for example, the bipolar disorder, which who has classified, and this bipolar disorder, it has been just been classified into, say, for example, 25 years, 30 years, or 40 years back, these bipolar disorders. Nowadays, the term is very, very common. We oftentimes read into different newspapers or newsletters or news magazines, particularly in relation to the medicines, these bipolar disorders. Many of the doctors are prescribing, but say, for example, 50 years back, these bipolar disorders are not so common. This terminology came into vogue into just 25 years or 30 years or 40 years back. But what this bipolar disorder states. It's an alternating depressive disorders with periods of manic syndromes. So there's a alternating phases. When the patient is in depression, the person experiences some depressive moods like sad or empty feeling or irritability is there. There is a loss of pleasure or interest of all the activities. And definitely, on the contrary, when this depressive phase is over, the patient feels some sorts of euphoria or irritability, increased activity, etc. So, similar classifications of mental diseases has already been mentioned in the Organon of Medicines 200 years back. And we should bow our head to Hahnemann for these classifications. It's simply the alternating states of the disease. In alternating diseases or alternating phases of the diseases, Hahnemann have nicely described when different sets of mental conditions alternates with each other. Yes, the terminology bipolar has not been given by Hahnemann. It has been stamped by the modern medicines, say for example 25, 30 years or 40 years back. But the descriptions of this bipolar disorder we find in the Organon of Medicines in different aphorisms, and they're also in the footnotes. Say for example 200 years back. So it should be kept in mind that Hahnemann was much ahead of time, which the modern medicines is recognizing today. So intermittent diseases, alternating diseases, and also the different classifications which have been given in the mental disorders are to be kept in mind in the clinics. Because if we consider the ICD classifications, definitely this is very important of ICD classifications and for the academic purposes. But as in homeopath, when we are in the chamber, when we are in clinics and facing the patients in daily life, these ICD classifications is very difficult to match with that of the clinical aspects. That is, the organon of medicines and selections of the medicines cannot be made on the basis of these ICD classifications. So we have to rationalize. We have to make a bridge between the modern medicines and the homeopathic organon of medicines. So which has been stated in the modern medicines in a elaborative way. We have to make a broader classifications and make them fit into the organon of medicine so that the clinical practice become much more productive, much more positive. So I'm not going into the detail. However, it was very nice presentation by Dr. Jhanwar. It's a very young doctor, and he has done a great job. However, we must thank the alumni associations for making such CME, and in the future we are expecting many more productive CMEs so that we can enrich ourselves. I am also grateful being a part of this. So thank you everybody. Thank you alumni associations. Over to Dr. Bidyut Mukherjee.
Thank you, sir. Thank you for your presence and your so valuable inputs. There has been an input from Dr. Srivastava, sir, which I had sent it to you as his network connectivity is very poor. He had sent it by WhatsApp.
Yes, Dr. Srivastava has given some inputs regarding the treatment that has been put towards him. What are the treatments of persistent nail infection after failing top-grade homeopathic repertorial miasmatic remedies? He stated that regarding the treatment of nail infection, uh, the treatment of nail infection may not be the target of treatment. Target of treatment must be on the underlying causes and others related complaints. Miasmatic treatment is one of the options. We should know about limitations also. That is the inputs from the Dr. Srivastava. Professor Srivastava has nicely, thank you for your inputs. So I'm just reading out, I have read out the inputs from Dr. Srivastava. Okay, thank you. Over to Dr.
Thank you, sir.
Mukherjee.
Thank you, sir. Now I'll request our beloved President, sir, Dr. Kalyani, to give his inputs and a vote of thanks and conclude the session. Over to you, Kalyani, sir.
Thank you, Dr. Bidyut Mukherjee. Many thanks to our inaugurator of the day, Dr. Surbhi Yaduvanshi. Many thanks to Professor Arijit Pal Choudhury for nicely moderating the whole session, plus contributing his own experiences and knowledges. Equally, we are very much thankful. We pay heartiest thanks to our brilliant speakers of the day, Jhanwar Lal, for presenting on mental disorders and homeopathy, and our beloved Professor Birendra Prasad Srivastava for presentation of nails. Both the sessions, definitely it will be a file for our practice and knowledge. Brilliant collection, brilliant presentation, I can tell you. Time is very short, it is already late. Just I want to add little bit to encourage you all that when I was a first year, second year student of Calcutta Homeopathy Medical College, I found one teacher. His name was Dr. H.P. Saha. When he is sitting in the OPD, whenever a patient comes before his table was very small, by his two hands, he used to catch both the hands of the patient, and Professor Shah will put hands of the patient on the table, and he will start gentle rubbing from the elbow up to the tip of the fingers by supine position, by pronate position. He will very carefully, he will go on seeing and touching and rubbing and asking questions to the patient. What is your name, please? Very gently, the patient will tell the name, and then he will ask this and that complaint, present complaints, etc., and he will prescribe. In later life, when we came to know by his reply that I asked first the name, I first developed a rapport with the patient by holding his hand and rubbing and putting on the table to show how much attentive, caring I am for your suffering. Number two, I ask the name when I am rubbing the hands to assess the status of the patient, the family status, how he is replying. Sri Omu, as per example, Sri Ramprasad Mishra or only Ramprasad Mishra, means mode of speaking, mode of presentation of his name by giving surnames, then your ornamentation of the names, Mr., Mrs., etc. He will assess his status of life. Then, very carefully, when we grown up, third year, fourth year, we came to know that he is very attentively looking the skin of the patient, touching the temperature, difference between the palm and hands. Then he is seeing the nails. We did not have that much knowledge. In later life, when we came to fourth year, in practice of medicine, we found that observation of nail has been put into the general survey chapter. Simply we committed to memory and vomited to khata, did not have that much of emphasis regarding the value of nails. Then when we gone to NIH, deep NIH course, when we are exposed to repertory, we found that nails is a beautiful chapter given in the hands big chapter. Later life, after a few years of experiences, what I experienced, you must agree with me, that the description of, vivid description of nails in repertory on the hand chapter should be replaced to nails in homeopathic generality chapters. How? Because by this time we had a thorough knowledge regarding physiology, medicine, and pathology. You must agree with me that nails are not only the nails. Nails are outward manifestation of a complicated tissue made from the skin, controlled by the exodermal layer of development. That means we had three germinal layers: ectoderm, endoderm, and mesoderm. This ectoderm layer is very, very important lining from where central nervous system peripheral nervous system, all endocrine system, skin, and nails are gradually formed. So nail, skin, endocrine system, and brain has got a link depending on the germinal epithelium. So naturally, you also agree with me that through the neurohypophyseal tract, by the control of the brain and hypophysis, pituitary, we have seen that whole system of the body is being controlled by this hormone through the instigation of neural stimulations. So what you are finding ultimately, as we have learned today also, that was a repetition, nice repetition by Birendra Prasad Srivastava, that deformity of nails has got multiple causes from generality to particular. Because of that, it is very confirmed that nails are not the nails. Nails are the homeopathic general manifestation of the person as a whole. So it should be a general symptom. We must give maximum emphasis on nails as a general symptom, not as a particular on hands only. As we have seen, desire, aversion, and craving, they are given in the stomach chapter of repertory. But by virtue of our experiences and by virtue of our physiology, medicine knowledge, and psychological knowledge, we have understood that the desire, aversion, and intolerance is not at all a symptom of stomach. It is a symptom of psychosomatic will. What type of psychosomatic will patient had is manifested by desire for salt, sweet, sour, etc. So that also, this desire, aversion, and especially desire, aversion, and craving should be put under the homeopathic general symptom. If not in mental chapter truly, definitely in psychosomatic chapter, I mean, it's very much important, which relates mind and body simultaneously. So likewise, today we have understood, we have suppled our knowledge that nails are not only casual nails, they are the expressions of violent disease of the body, including fatality of the patient. Regarding nails, we got details, information. Especially, I should pay special thanks to Birendra Srivastava for showing the photographies. Definitely, it's a very brilliant collection. All of us will be able to preserve it. We will go through it intermittently to assess about the nails, its causes, and homeopathic symptoms. Definitely, he has also told that nails are not the only guideline, but nails are definitely one of the important general symptoms of the patient during case taking. Now, regarding mental symptoms, one more, doctors, I forgot to tell you, when we first saw Dr. H.P. Shaha in first or second year, then we grown up in the third year and early fourth year, we had a doctor called as Dr. Hassan. He is practicing somewhere in Hooghly district of West Bengal. He is seeing the patient who are in the queue on standing position. Patient did not have any seating arrangement. Only doctor has a sitting arrangement with a very small table. He will simply, Dr. Hassan will simply see the nails of the patient and he will immediately prescribe in a very short period without asking much details of the case. At that time, we were criticizing him that he is not at all homeopath, he is a magician or some very common peoples to give public puzzles or public stunts. But now, with the age and experiences, we are realizing that yes, of course, by seeing the structure of the body, by seeing the nails, many drugs can be assessed without asking much details of the complaints and their modalities, if those indications are very striking and persisting for a very long period. So naturally, the importance of nail you have realized. Now regarding mental symptom, nothing to do, nothing to say more. I should say that mental symptoms and their management treatment, as Dr. Arijit Choudhury nicely expressed, that it is homeopathy is much ahead of present modern psychologists. I told you once, so far I can remember, we had one teacher, Madam Sunipa Sinha, in DPNH course. All DPNH students know him very well. He was very, very beloved madam. He used to teach us psychology. We had a chapter, we had a subject of psychology in DPNH course, and he was MBBS, MD, and MSc in psychology. such fine qualification. He asked me once, can you give your repertory? I want to transfer or translate the repertorial language into modern psychological languages for your convenience. Plus, I want to get enriched by your mental symptom because I have gone through it. After going through the mental chapter of repertory, Madam Sunipa Sin is telling, I have gone through it repeatedly and found that there are immense materials which are yet to be revealed by the modern psychology. I gave the repertory. He took 3 months of time. After 3 months, Madam Sunipa Sinha returned the book back and told, sorry, Dr. Kalyani, I could not be able to help you because to translate the homeopathic information in mental chapter into the modern psychological chapters is not very easy thing. There are many more things than present psychology or psychiatry. So I tried my level best for more than months, but I could not make the exact changes from homeopathic point of findings to the modern point of finding. And my opinion is your findings in the repertory book is much finer, much particular, much symptomatic than modern psychology and psychiatry. Our psychology psychiatry is completely based on symptomatology. No pathology usually found. Simply by totality of symptom we go on treating. Your pathy is also symptomatic. But what I have experienced that your symptomatology regarding mental symptoms are much advanced than that of the modern system of medicine. Since then, I many times have told you in my classes that go through the mental symptoms of the Kenton repertory, will be much enriched than the modern system of medicine. They are classifying, grouping, adjectifying, ornamenting, but the basic things you will get much more in mental chapter of repertory. Moreover, as we have heard that mental diseases are one-sided, definitely one-sided diseases, but what we find in practice, in hospital also, there are many more mental cases with many other physical symptoms too. The cases of mental disease with physical symptoms, if we get homeopathic general physical symptoms, it is very, very fine. We are very lucky. Even you do not get homeopathic uncommon peculiar symptom as a general. If we try to emphasize on particular symptoms which are uncommon to some extent, or common symptoms sometimes to some extent uncommon with the mental complaints, those cases are more convenient to treat and to cure. That I have experienced in NIHOPD. So don't get worried. Do not be afraid, scared of one-sided disease. Definitely, you have heard that one-sided disease are very difficult because they are having very little number of symptoms. But many of the cases what I have experienced that there are symptoms, we have to search it out. Simply do not consider mental symptom as 1 or 2 symptoms. Go on searching, observe it. You'll get many things which is not being expressed by the patient, not by the party. You'll be able to find out. So mental disease is definitely a very, very wide field in homeopathy because we know there are chances of recurrence by conventional system of medicine of the disease. But if one patient of mental disease get cured by homeopathic medicines, whether it is constitutional symptom totality or by one-sided medicine by miasmatic 2, we have observed that very, very rarely the patient comes back again with the same complaint. That means relapse of the mental symptom is very, very rare in case of constitutional homeopathic symptom, homeopathic treatment than that of conventional treatment. Moreover, if you treat homeopathically, patient do not need to continue the medicine till his last breath or for a very long years and change atmosphere accordingly or to give counseling as a must. What we have observed that if right medicine is given to a mental patient with some other complaints, we have seen that patient himself develop the adjustability with the society. As per Freudian principle of psychology, Dr. Freud told that there is no one as normal psychological person. Everyone is psychologically altered, deranged, which is adverse to the society, unbearable, uncomfortable for the society of that person is usually called to be mental symptom, mental patient. What you observe that if we treat homeopathically, not only the complaints goes out, not only patient's recurrence or reappearance or relapse is been arrested, but also patient develops a quality of improving himself. I am telling one example. The patient was depressed by a shock Say, for example, disappointment. We have seen after giving ignitia, patient has become a lady of challenge that I don't care any boys. I will grow up. Again, I will marry. I will find out a good boy better than the before. I don't bother. I don't remember. Means this attitude, absolute change of this depressed, soft attitude gets changed to fight with the society. This is an excellent output of homeopathy. Means whole picture of the personality, psychological defense mechanism, adaptability, everything completely change as per suitability of the patient. This is very, very rare cases. Seldom will found in the conventional medicine, which is very easily means if we can select the medicine, right medicine, that you get change. So anyway, definitely mental is one-sided, but we must not forget to find out few other symptoms, whatever little it is, to make a totality. Again, I'm thanking to all the brilliant speakers, persons on the screen, persons out of screen, those who are viewing, those who will view later on. Thanks to everybody. I'm very, very happy that you are coming forward to encourage us. Please come forward, being prepared. I request especially to Dr. Arijit Pal Choudhury. You have immense experience. Please come and share with us to encourage us to increase our knowledge too. To everything, same thing to all the alumni. Please come forward voluntarily. This is our home, our made platform for all of us. We all want to grow gradually up. So thank you very much. Thank you very much. Good night. Bidyut, please.
Thank you, sir. Good night. And by this, we are returning back to our backstage editor, Orko. We'll be meeting again on 23rd of this month for our 59th CME. Over to you, Orko.
Thank you all. Thanks for watching. I hope you have enjoyed this video. So now it's time for the certificate issuation thing. So the first issue is related with certificates. So let me just tell you in brief that since we were facing some uh, technical and physical problem with our IT team, so we are currently doing our work, trying to do our work as hard as possible so that we can again resume this certification process as soon as possible. And the next thing is that for the same reason is for that we are not updating the Spotify at a regular basis. So pardon us for that because we had our exam, then also pujas, everything just went up the chaos. So we were irregular on the Spotify thing, but we are promising that we will be starting resuming uploading on Spotify too from next sorry from next Sunday onwards. So be if you have still not yet followed the Spotify playlist, the link is in the description. Please do make sure to follow it. And with this, let me just come to the end credits. Um, do make sure to like our Facebook page. Also follow us on Instagram and Twitter. Link is in the description below to get updates on next CMEs and what our alumni are doing on our day-to-day basis. Also, what is happening on NIH, etc. things. You will be getting updated. Also, we have a Telegram channel. The link is also given in the description. We update there too the scheduled program. Also, if you have not subscribed yet, do make sure to subscribe. Click on the red button, red subscribe button, and then press on the bell notification, clicking all, so that you will get notified as soon as we schedule a program. And this was it. So see you in our next CME. Until then, it's me, Orko Mukherjee, moving on to post CME talks. Good night to all the viewers who are watching live and will be watching on a recorded version.